Today is 14 November 2019. This is a 5-year-old female entire poodle.
Okay. Now, this purpose of this educational video is to show owners that what is to be asked of the vet and what is the vet should do when there is an annual examination of the dog. Now, of course, many owners, they don't bring their dogs for annual examination, so there's a disadvantage in that the health of the mouth and the reproductive organs normally are the two main things which the vet should discuss with the owner. Okay, now we look at this dog. This is a female dog. Entire means did not sterilize her. The reason is because you all want to bring her. So it's already 5 years, and the owner didn't find a male dog for her. Now, normally female dogs after 5 years, they are not so good for producing puppies. So the best time to produce puppies are 1 to 5 or 1 to 6 years old. After that, the quality of the puppies are not so good, but breeders still do it. Now, the main thing about checking the reproductive system of the dog is that at 5 years, some of them do develop tumours of the breast. But of course, the vet should examine it every mammary gland. There are 5. Should examine it for any lumps, and 5 on either side. So this is MG5, MG4, MG3, MG2. Then there's an MG1. Sometimes it's missing, but MG means mammary gland of the right side. Mammary gland on the left side, MG5. Let me feel, is there a lump? Yeah, there's a small lump there already. A very small one, and the dog reacts to it. There's some pain. So they're starting off a tumour, but very small. Okay, then MG4, okay. MG3, okay. The dog doesn't bother her. MG2, no lumps. And MG1. Sometimes MG1 is absent, but it should be around here. So I would say that in between you still have to check whether there are lumps or not. And these are called mammary gland tumours. Quite common in dogs that are not sterilized when they are young. Now let me check again this one, the MG5, whether the lump is there or not. It's a very small one, so it's good and bad. Good in the sense that if the owner sterilizes the dog and remove the ovaries, the female hormones are normally the ones causing the breast tumours to grow. And some of them are non-cancerous, so they are just small lumps. We just had a case this morning where the owner had this dog had this breast tumour. You will see in another video. And this tumour has been there for 2 or 3 years. It didn't grow, and so the vet consultant says that wait and see. So of course the owner waited and see, and the last 2 months the tumour just exploded to become a big golf ball, and the dog licked it, and it became infected and ulcerated. So at this time the dog is already 13 years old. So, and she was not sterilized, she was not spayed. And so I told the owner the chances are that since the tumour has grown so big, within 2 months it's likely to be cancerous. So even though we operate, it might come back again. So the moral of the story actually, you just sterilize the dog when she is young. Young means 1 year old to maybe even at 5 years of age. It's still much better than wait till the dog is 10 years old and then you start to find breast tumours. So this is the first aspect of explanation to the owner if the dog is not spayed, because some owners don't want to spay the dogs for humane reasons, that the dog should be like human beings, not sterilized. So now the second part of this examination or the second most important part is the teeth. Now there's some bad breath. Now you can see there's a gum disease. You see tartar, and the gums are red. And the strong smell, bad breath. But in this case, it's 5 years old, so it's not so bad yet. You can see that the gums are not really, except for this canine teeth, it's a bit exposed. Other than that, they still, you can still save the teeth. The roots are still okay. Now you see this side, come this side. Now no matter how you brush the teeth, the dog still has this tartar, but this side seems to be less. Now in Singapore, some owners, they go to the groomers, and the groomer will do some dental scaling for them, but I wouldn't advise it. Now you can see this dog, this one is a bit loose already, the front teeth. So have a quick look. Now the dog is still young, so there is no gum tumours. And some old dogs, because it's so old, the gum become swollen with tumours. It's called due to poor hygiene. But this dog is okay. So these are two things. Other than that, I will just do a quick physical examination of the heart and lungs. Come. Okay. The nice new poodle. Color is good, body condition is good. Not too fat, not too thin. Come, stand. Heart is okay. Any coughing? No coughing, so she's alright. Lungs alright. No harsh sounds. Quite nervous now. So I would say that the lungs and heart are okay for dental scaling, anesthesia. Okay, now I'm examining the abdomen for any swelling of the kidney, liver, and any internal organs, any swelling. So you see I press at this, thumb with 4 fingers, the anterior, middle, and caudal. Okay, start from the front. Front usually the stomach, kidney, and liver area. Spleen is there. Now you can see the dog doesn't react, so there's no pain. There's no swelling. Swelling, I can feel it. But now in the middle, now I can feel that the dog didn't pee, right? There's swollen bladder, it didn't pass water, so you can tell that it's swollen. So the vet has to do a few hundreds, so they know exactly what's inside. But sometimes they don't do it, they just give the vaccination and bye-bye to the owner. So by right you should do. And this one I know the bladder is full. Right? Didn't pass water at all the whole day?
No, don't have it. That's why we came home. She
has eaten. Unless it's stomach. It's not say very full, it's not very full.
But she drinks water a lot.
Drink a lot.
Then she pass also.
Drink a lot is not good. How much do you drink? So we'll check. 200 ml. The average dog drinks about 200 ml of water a day, 24 hours.
I think not so much.
Not so
but
much.
she should drink.
So you can feel if there's any swelling of the uterus. Okay, so nothing. Okay, stop now.